Assalamu alaikum wa rahmatullahi wa barakatuh. Very good day to you. Welcome to our second episode of Health Matters Extra. Warm welcome to you. Thank you so much for joining us. Please note, for any of the shows that you have missed, follow our ITV Network's YouTube channel, and you can also live stream right now to tell your friends and family on itvnetworks.tv. Watch live. I'm Khawa Solomon, and the big question is, are you at home? Are you quarantined, self-isolation? Are you definitely in lockdown? We have the main message here today and every day on Health Matters COVID-19 Extra. Stay at home. So a big thank you to our IMA team for always providing us with content and information. Today's slogan, we will be highlighting #social distancing. Today's topic is mostly about masks, so please stay tuned for that. We're also linking up with our correspondent today in Cape Town. We're chatting to Dr. Shuaib Wadi, PRO for IMA and also nephrologist. Today's focus is masks. So everything you need to know and want to know about masks, please interact with us. Our WhatsApp line is available. We will not be taking calls, but do interact with us during the show and after the show as well, because remember, you do make the show. So let's first link up with our contact in Cape Town. This is Shafwan Lobsher from Cape Town. He represents the Bukab COVID-19 team. As we know, the first resident from Bukab has passed on. I think she was the second infected positive person for COVID-19. I stand corrected, 81 years old. She passed away in hospital a day or two ago. Very sad, somber feeling at the residence in Bukab in Cape Town. But we hear from the representative for this organization, Bukab COVID-19 team. Shafwan, assalamu alaikum to you.
Walaikum salam wa rahmatullahi wa barakatuh. Thanks for having me.
Shukran so much for joining us and being part of our correspondence in Cape Town. Shafwan, tell us, Shafwan Lobster, tell us about what had happened today. Apparently, the government did, whether it was testing or possibly testing, what was happening today with the Bukab residents?
Yes, so today the Western Cape Health Organization set up the pre-screening teams, as well as physical testing in Water.
Mm-hmm.
So what happened was these testing happened concurrently. So it was a pre-screening team that went door to door to all the residents, and then based on the questions that were asked to the residents, the screening, based on that, they would determine from there if you are required to do physical testing. If so, they would then refer you to the test center, which is also situated in Water.
Mm-hmm.
And from there, obviously, the physical test will occur, and then the patient or the people will be advised of the results a day later.
Okay, what does pre-screening mean? Is it just answering questions?
Correct. Yes. So pre-screening just contains a few questions based on symptoms that you might have for the last couple of days, a week or two. So if there's any change in your health for the last couple of days, so the questions are quite simple. It needs to ask you simple, strict to the symptoms that you might have. And from there, they will determine if it's worth it or best.
Okay. We do apologize. The line is a bit patchy. Shafwan, shukran so much for your time. So please note that Shafwan is our correspondent in Cape Town, Bukab. Shafwan, we understand that the testing did take place in Bukab. How many people were they able to do this pre-screening with?
Yeah, so for today was the first day. We'll obviously do it for a couple of days, so we cover the entire area.
Okay.
But today we did a few splits. We did, I would say, roughly about 100 residents. There was a few that were referred to do a physical test. I think physical test that occurred was about plus minus 30.
Okay, so the test that was done physically, will that still continue tomorrow?
Yes, definitely. So the plan is to do the entire workout. So it definitely will carry on until we have reached every household and working.
Okay. So I believe Bukab lost it's I think the second death of COVID-19, second person that was infected with COVID-19 in Bukap. She has passed away a few days ago. Tell us how that affected the Bukap residents.
Yeah, definitely. It's sent shockwaves through the community. Obviously, we occupy the community in Bukap where everybody knows everybody. So really hit hard home. And so, yeah, everybody's quite anxious and worried, obviously, what if. But that's where we come in as a response team, as well as the Western Cape Health, which can just restore some sort of calm within the community and reassure it.
So we have found areas, of course, in informal settlements in Cape Town and others in Johannesburg, where residents are not very cooperative. What are the residents of Bukap like? Are they abiding by the rules that are set out with regards to the lockdown?
Yeah, so for the most part, I think the community is abiding. I think they're doing well. We can obviously do a bit more. But I think for the most part, they are abiding by the rules. But, it does get a bit tricky sometimes within households that we have obviously more people in the house. So it could get a bit trickier sometimes. But that's where the response team comes in also, because we try and alleviate some of those type of issues in Bukap and also provide some relief support in the water.
Now,
so even, sorry, go.
No, I just wanted to check with you, Shafwan. We need to go quickly for a break, but before we do that, with regards to the testings that had happened, what were the response of residents? Were they quite nervous? And also the health department, what was their gear like? Did they wear the PPE suits or just masks and gloves?
So from the health perspective, they didn't do the full entire PPE. They obviously adhere to the 1.5 minimum distance between people when they do questioning or the pre-screening. So they adhere to that. It's just masks and gloves and obviously social distancing. Keep a safe distance when they do the interview. The residents initially, to the couple of days leading up to today, were quite anxious and nervous because of some fake news that has been spreading on social media. But
yes.
Obviously, as a team, we also try to quieten that or control that type of anxiety that might exist. So the days leading up to today, we have advised on the procedures that will take place.
Okay. So what is your responsibility and your message as we end off this interview, Shafwan?
Yeah, so our responsibility is to try to support our community. We try and provide relief support in terms of food. We've also doing shopping for some of the houses in the community. But my message to the community is just to continue adhere to the rules and the protocols that are set in place. And, practice social distancing, practice good hygiene measures. And from there, we can just together try and beat the situation that we are in.
How can people get hold of you if, help is needed? And I think it's just mostly for the Bukap residents. Do they all know of you?
Yeah. So on social media, we are on Facebook. There's a Bukap COVID-19 community response team page.
Okay.
So obviously people can just, all our announcements and notices are posted on there, so people can get hold of us from there.
Great stuff. Shukran so much to you, Shafwan, to you and your team. Everything of the best. Please do update us on a regular basis what is happening with the residents in Bukap. We really appreciate you and your team working hard, I'm sure 24/7 literally, to keep residents safe and in line during this 21 days of lockdown. We appreciate your time, Shafwan. Shukran.
Thanks so much.
There we go, Shafwan Lobster, and he, you can see, is in his mask suit, and shukran for his time. They continue doing testing in Bukap tomorrow. We quickly show you how, and highlighting the theme for today with regards to masks, how to make a mask, and very easily how to make one. Watch this. How simple is that? Have no excuse not to make your face covering or your simple homemade mask to protect yourself when you're going out. A tissue, roller towel, elastic, a stapler, all the things you probably already have in your home. But stay with us as we link up with IMA PRO, Dr. Shuaib Wadi, nephrologist, and we discuss this issue on masks just after this. Assalamu alaikum, welcome back. A very good day to you. This is Health Matters COVID-19 Extra. Shukran for joining us, and please do stay with us right up until the hour of 5 p.m. I'm Hawa Solomon. Do direct any questions, comments and queries to our WhatsApp line. We will definitely include it in our next show. We want you to be part of Health Matters COVID-19 Extra. So online we have nephrologist Dr. Shuaib Wadi, and also part of the IMA team. We appreciate his time. Assalamu alaikum to you, Doc. Welcome to Health Matters COVID-19 Extra.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
So we see you in a different light today. You in your work clothes, at your job, doing what you need to do. Okay, so quickly tell us about the IMA Masks project. We want to start off with, of course, what one of the organizations are doing, and IMA is one of them. What is IMA calling to all community members with regards to masks?
So what's happening is that there is this sort of shift in the mindset around the world that it may be beneficial for people who are going out on the general day-to-day errands in supermarkets or leaving their home to wear some sort of mask to prevent them from coughing out or producing secretions which then can infect others. Mm-hmm. So the mask itself is not a protective device. It's not being used by health professionals to protect them. It's not part of personal protective equipment. But what it is, it's a way to block your mouth and nose when you're coughing and when you're talking, so that those droplets which come out of your mouth and the nose will get caught by the mask. So it will only work, the logic is that it will only work if a large number of people do it. That means 70 to 80% of people in the community do it. It means that the amount of virus being shed by people who may be very well, not even sick, people who are asymptomatic or who are minimally unwell, who don't even know they have COVID-19 and maybe walking around in your supermarket or maybe walking around in your place of work. If they are wearing a mask and talking and coughing, obviously the mask is going to catch their secretions and their saliva. And there is some epidemiological evidence that may help to reduce the spread in this circumstance. Obviously, the surgical mask that you just showed and other specialized masks, which are filtration masks, are in really short supply. They're very expensive, and they should really be reserved for health professionals who are looking after people who have COVID-19. So the idea is then to try and make cheap but effective masks made out of material, cotton and other substances, 1, 2, or 3 layers thick, which can then catch those secretions. And the idea is then those masks can be reusable. There are very many innovative ideas. Some masks have been made with little pouches for filters that you can put in, things from panty liners to vacuum cleaner filters, which can then catch moisture and then prevent the mask from getting wet. So there are innovative ways to try and do that. And then the idea is to get a couple of masks. Many of these masks are very cheap, 15, 20, 30 rand a mask, and buy the mask or buy a few masks, 5, 6, 7 masks, and wear 1 or 2 every day and wash them. Wash them properly with warm, quite hot water and soap every night, allow them to dry, and then recycle the mask. So for the price of maybe 40 or 50 rand, you could have enough masks to last you for months. So the idea is that the mask may eventually become the must-wear item for 2020, 2021. And if everybody's wearing a mask, it may mitigate the spread of this virus, particularly as we start emerging after lockdown. So that's where people in the US, like the CDC, have started recommending, it's not mandatory, it is mandatory in some countries, But in the US, it's not yet mandatory, and obviously in South Africa, it's not mandatory. You won't get fined if you don't wear a mask. But the suggestion is that if everybody can wear a mask. So the IMA has embarked on a project. Obviously, masks are not affordable for everybody. IMA has embarked on a project to try and manufacture these masks relatively cheaply and then disseminate them in a widespread way. Obviously, it's not going to be only the IMA. There are many organizations who are doing this. There's a Mask for All campaign, which is being coordinated by some health professionals, including the IMA, Professor Shabir Musa, many other role players in that organization, across different faiths, to try and have a project where you can produce these masks in a large scale. Obviously, producing these masks creates employment for people as well, and then pay these people to produce the masks and then disseminate it in a widespread way throughout South Africa, especially amongst the poorer population.
So we have some people saying that, listen, I don't need to wear a mask. I don't have any symptoms. And of course, they're possibly asymptomatic as well. So what do you say to them? Because at the end of the day, it's not just about you.
So remember, what I'm saying is not concrete, carved in stone evidence that it's definite you must follow this because the evidence is overwhelming. What I'm saying is based on epidemiological evidence and a concept that recommending everyone wear a mask is unlikely to cause great harm in this context.
Okay.
And also it's likely to save the medical masks, the surgical masks, which are then needed by the healthcare professionals. And also it's a cheap intervention. So it's not something which is going to cost millions of rands to do. Each individual is going to cost them a few rands out of their pockets. Those who can't afford it can be subsidized by those who can afford it. And the idea is that my mask protects you and your mask protects me. So the mask you're wearing protects others around you, doesn't protect yourself. You're not wearing this mask to protect yourself. It's an act which you are carrying out on the chance and the outside chance that you are an asymptomatic carrier or that you may be producing secretions that can then infect others around you. And it's very necessary when you're going to public places. So if you go into the supermarket and you may cough or you may be talking in the supermarket, there's a chance that some of your secretions will then find its way onto items in the supermarket, and then other people can touch them. They may touch their faces and their noses, and then they get infected if you are infected. So the idea is by wearing a mask, you mitigate that effect. So you protect others. But as I said, it will only work in an effective way if everybody does it.
Okay, so let's talk about wearing a mask and wearing it correctly, because initially the CDC said, World Health Organization said not to wear a mask. Why was that, and how can that help now when we are wearing masks?
So the CDC in the US initially, their guidance was, and this is the guidance from the World Health Organization as well, was that the general public not to wear masks. It's based on studies which show that the mask doesn't protect the wearer. So the mask does not protect the wearer. So they said the general public doesn't wear a mask, but if you are coughing or you are ill, you should wear a mask. So, but there's been a realization in the past sort of month or to 6 weeks that there are a number of what we call asymptomatic or minimally symptomatic carriers. That means there are people who are walking around who have very mild symptoms, maybe a very mild cough, maybe a bit of a sore throat, and they don't really feel ill. So they don't feel the need to wear a mask when they go out. And then they go out. They go to a supermarket, they go wherever. And then they may be actually carrying COVID-19 and then cough, and then they may then be spreading COVID-19 silently. So the recommendation is that everyone wears a mask. So in case you're one of those people who have mild disease or asymptomatic, you will protect others around you. So the CDC has obviously then since changed its recommendation. And because they want to protect the supply of medical grade masks and proper filtration masks, they are asking the public to make fabric masks or masks made out of material. And then obviously to wash those masks. If a mask is not used correctly, you keep touching it, keep filling it, taking it off, taking it on, leaving it everywhere, it's not going to protect you or anybody. It may actually increase your risk of getting infected. But if you wear the mask, don't touch your face, make sure it's a comfortable mask, wash the mask regularly. In fact, get 2 or 3 masks to wear a day, and then use a mask for the morning, wash it in the afternoon, use another mask, and the next day when you're at home, you don't need a mask. The next day, hopefully those masks are dry. Or you have 4 masks, so the next day, while those are drying, you have another 2. These are expensive items. I mean, you should think of them like underwear. You should be wearing underwear every day. And you wouldn't, it's a social norm for centuries to wear underwear, maybe not in Scotland. But I think it will become a social norm in the next 2 years maybe for everyone to wear a mask. And I think we need to embrace that because of the potential it has.
Okay, so understanding when wearing a mask, and initially when they said do not wear a mask because it might just cause infection, the spread rather, you touching your mask, the whatever contagion is on the mask, the virus is on the mask, and you're going to be spreading it everywhere. So guide us on when we are wearing the masks.
Very importantly, if I can just interrupt you, very importantly, you must make sure that you continue the other anti-infection measures. You must continue with the social distancing. Don't put yourself right in front of other people for the time being. Keep a healthy distance, 2 meters, if you can. And the hand washing and the hand sanitizing will have to go on. So you can't wear the mask and then believe, I've got a mask, I'm not Superman, I'm protecting
that
myself
says masks, they're going to make the masks.
I'm not going to get infected.
That's right, Dr. Shoaib, shukran for that. So understanding that we have to go out, the essential service providers are on the roads. Is wearing a mask enough for them to protect themselves against this virus when they are on the road?
As I said, the mask is not to protect themselves. The mask is to protect others. But obviously, if essential service workers are treating people who are potentially infected with COVID-19. So, for example, if an ambulance goes out to a home where somebody may be infected with COVID-19 or they have symptoms, or even if they're not sure, they should ensure that the person they're going to collect or going to treat wears a mask. If that person doesn't wear a mask, they should cover their mouth and nose with something until the ambulance can provide them with a proper mask. So they can use a scarf. They can even put their shirt over and cover their mouth and nose like that until they can get a proper mask. And then obviously once an assessment is made as to whether this person can have COVID-19 or does have COVID-19, some of those things can be changed and relaxed. But certainly I think we're going to move to an era where it may be prudent for everybody to wear a mask because you may want to behave like everybody is a potential carrier until we know otherwise, until this epidemic is really gone. There's always a risk that even though the numbers are low, as soon as we put ourselves at risk, open up our society, there is always a risk that it may flare up and the numbers may start rapidly rising.
Okay, so we're going to go for a break quickly, but before we do that, I think Dr. Shoaib, just explain to us quickly the drive with the IMA. What are they calling out to community members? Because they're saying, people at home, if we can sew, please help us.
So, I mean, this is not a project which is, as I said, just of the IMA. It's a project which is collaborative. But the IMA has got a specific project where we're trying to get people who are able to sew masks, and obviously then we can try and remunerate them. And then secondly, to remunerate them, we need to raise funds. So you can contact the IMA, you can donate money directly to the IMA's account, you can go to Tawakkal, the crowdfunding website, and donate to this project. And then that money is then used to pay people who produce the masks. There's no administration fee or anything taken out from the IMA side. There is an administration fee from the Tawakkal website, which is minimal. But the idea is then to raise the money to get people to produce the masks. There's basic costs like buying the material, the elastics, the different cotton and so forth and so on. And then there's also the labor costs for the people who are doing them. And then to produce the masks and then to try and distribute it widely using the existing platforms, working together with other organizations.
Okay, so you can visit the IMA website and also WhatsApp us. We will show the number on the screen, and we will send you the necessary contact details of the IMA and their locations in the areas that you are in, because remember, this is throughout South Africa. So we know that in some countries, actually I've watched some horrific videos in the US, where there are medical staff, nurses and doctors basically wearing their protective necessary measures, that they have the masks and the PPE suits, sometimes not for the durations that they're meant to, for longer than the time that they're supposed to be using it. Do you think in we're hoping that it doesn't actually happen. But in South Africa, when it does come to that, wearing black bags, having to make your own masks, are we going to come to a situation where South Africa will then run out of personal protective equipment and there won't be any masks and the PPE suits available to South Africa?
So, I mean, this is a distinct possibility. So that's where this whole concept of flattening the curve comes in. It's not just masks we'll run out of everything. We'll run out of hospital beds. We'll run out of doctors. We're not a very well-resourced country compared to the northern countries like the US, UK, Italy, Spain, which have really, even with relatively well-resourced healthcare systems, have really struggled. Obviously, the NHS in the UK has had some of its guts torn out of it by the conservative policies over the past decade or two, and has struggled related to some of that. But Italy had one of the most sophisticated, well-developed healthcare systems with good processes, and they got overwhelmed. So really, the flattening the curve idea is to decrease the number of cases we get at one time. In a worst-case scenario, if we have a million infections in South Africa over a short period, which is like 2% of our population. If only 2% of our population gets infected over a 3 to 4 month time, and half of them are asymptomatic, that's still 500,000 symptomatic infections. And then you take 10% of those people who are likely to need hospitalization, that's 50,000 people. If we need 50,000 people who need hospitalization within a month or two, there's no space for them. There isn't space in the hospital, the private hospitals, the public hospitals, there aren't beds for them. So many of them will die because they just can't get a space. They can't get a doctor to see them. They can't get into a hospital. And then many doctors and medical staff will be incapacitated. So what happens is that the number of doctors that you have available to treat these patients also gets severely limited. The number of nurses gets limited. The number of other support staff gets limited because those people get infected because of inadequate PPE. So even if you have adequate PPE, there's the risk of infections. But if you have inadequate PPE, that means you don't have proper equipment, you run out of masks, you don't have goggles, you don't have visors. Some of those things, there are huge projects in South Africa to try and create those things. There are some innovative projects. There's a little box which has been developed by Johannesburg Hospital, which is modeled on models elsewhere in the world, which allows these doctors to incubate patients without putting themselves at much risk. So we're learning from other areas of the world, and inshallah we'll have enough time to take home some of these lessons and mitigate some of those circumstances which they have. But if we do have a massive number of patients over a short period, even 3, 4, 5 months, it's very unlikely that we'll be able to cope, and there's likely to be a significant amount of what we would call preventable deaths. That means deaths which occur just because of a lack of resources. Those things are already occurring in South Africa, even today, right now. There are preventable deaths because we already have inadequate resources. But you can imagine what will happen under a constrained system with a massive assault. Like
Absolutely,
this. And I think that's why people are willing to justify the economic and other effects of this particular lockdown.
So we continue our conversation with Dr. Shuaib Wadi, nephrologist, guiding us on with regards to masks, flattening the curve, social distancing, and more on our WhatsApp line. Please do interact with us. Stay with us. Assalamu alaikum. Welcome back. A very good day to you. This is Health Matters COVID-19 Extra. I'm Kowa Solomon. Stay with us right up until 5 o'clock. Inshallah, we update you on the latest and what you need to know with regards to masks specifically today. We have Dr. Shuaib Wadi, PRO for IMA, nephrologist as well. And the IMA team, we have to give a big thanks to them. Please support all your local organizations that's calling out, whether it's a donation, whether it's an extra can of food that you're able to give, please donate. There are people that are in lockdown, but they don't have the necessary facilities that we have. So please support all your organizations, including the IMA. So let's continue our chat with Dr. Shuaib. But before we do that, we play you another video of how healthcare workers are also doing it for themselves and making their own masks. Take a look. Okay, so let's quickly catch up with Dr. Shoaib. Dr. Shoaib, we have quite a bit of questions to ask you, but before we do continue, I want to play the video that we have where the staff and sometimes the medical staff are having to do it for themselves and they're making their own protective measures. So have a look at this one.
Hi everyone, my name is Rose Hedges and I'm the Nursing Research and Innovation Coordinator here at St. Luke's Hospital, Unity Point in Cedar Rapids. Today we're going to be talking about how to quickly make a face shield out of some materials that you can easily get access to. So the materials that you're going to need is the air conditioner foam weatherall or weather seal. It doesn't have to be this, but this is just a 1x1-ish block of foam, some double-sided foam tape, some elastic, doesn't matter how wide it is. This happens to be an inch, about 15 inches is what we have here. And some scissors, transparency film, clear piece of plastic is what that is, and then a stapler. So I have my materials pre-cut here, but just to start here, we'll take our transparency film, our double-sided adhesive tape, and kind of put that on our transparency film here. And you're going to leave an inch on either side so you can see where the tape is at, and then I still have about an inch on each side. I'll take the other side of the tape off, place my foam over top of that, push it down, give it a good seal. Then I will take my elastic and we're going to use that 1 inch that we left here to kind of staple a couple staples here on each side. And there you have it. Thanks for your help.
Easy and simple, there you have it. Lots to do where it does come to emergency, and even the medical staff is doing it for themselves. Okay, Dr. Shoaib, quickly, your comments on that video.
So as you can see, can you hear me?
Yes,
Howard?
yes, go ahead, sir.
So as you can see from the video, there's obviously been a move for people to create some aspects of the protective equipment which it is possible to create, and the visors which are designed to prevent droplets from splashing into people's eyes and onto their faces, which can then obviously get into their mouth, noses, or eyes and infect them with coronavirus. Some of them are expensive, some of them are not easy to get, some of them are in short supply. So what has happened is there have been a number of innovative ways to make these visors, and visors are not that difficult to make, as you can see there. You could also wear goggles, and many people are wearing different types of goggles to try and protect their eyes. The masks, however, are a bit harder, especially the specific type of masks that you need to prevent the droplets which are in the air, small aerosolized droplets which are in the air, which then you can breathe in directly. A normal surgical mask doesn't work. You really need those specialized filtration masks like the N95 or the FFP2, which are then fit tested. They're fitted properly onto the face and checked for leaks to make sure that they're not leaking. And that then can prevent you from inhaling those droplets. So, and obviously they are much more sophisticated devices. The problem is these N95 and FFP2 masks are being bought from pharmacies, from other places by the general public. So the general public is using them when they really don't need them. They're not dealing with people who are sick or coughing in their faces all the time, and then therefore they're creating a demand which is unnecessary, and they're creating shortages for these essential pieces of equipment. So I get a bit peeved when I see people driving around in cars and walking around in general wearing N95 or FFP masks and so forth, because they're really it's not necessary for the general public, and they are creating a shortage of these masks in the in the healthcare sector. And they've also driven the prices of these masks up to 15, 20 times. So obviously that's unfortunate.
So do you think, in your opinion, that the government should then maybe have a drive that all these pharmacies or, all these places that are selling these masks that are meant for medical staff should not in fact sell them?
Yeah, I think absolutely they should. But obviously, we live in a capitalistic society where I'm sure if you offer the pharmacists enough money, they will give you the mask, regardless of what the regulations say. So I think we will reach a state where we should maybe encourage people to wear these cloth masks or a simple surgical mask, but a better cloth mask, because everybody can make their own. There's no demand. And those masks are not necessary for medical professionals. They're not the ones that we need to be able to treat patients, but they can obviously reduce the demand for the ones that we need. The ones that need to be used by medical professionals, by nurses, by doctors. I mean, nurses spend hours nursing patients for these conditions, and the risk of them getting infected without proper protective equipment is really high. And it's really depressing and sad to see nurses wearing plastic bags and other things to protect themselves, and then you'll go on a video and see someone who's packing groceries at Checkers wearing a full bodysuit and an FFP mask. That's really inappropriate.
Okay, so let's look at Sweden. At the moment, they're combating the spread, or somewhat, and they don't have a lockdown, but they're using masks and social distancing. What is your comment around that?
Sorry, I didn't hear that. I didn't hear the last part.
So in Sweden, they are not using the lockdown as a precaution to stop the spread of COVID-19. They are using masks and social distancing. What is your comments on that?
So, it's difficult to know whether that's effective or not at the moment. So Sweden some people say they're dicing with death and they're experimenting. It's difficult to know whether it will be successful or not. Obviously, as you know, a lockdown has major and serious social and economic consequences for a country, as we've seen in South Africa. Businesses close down, some people's income drops practically to zero, and their expenses may not necessarily drop, especially small business owners. Obviously, government has put things in place to try and mitigate that. But in Sweden, where they're a much more well-off society, they have one of the highest per capita incomes, they have a very well-developed healthcare system, and they have a relatively small population relative to the size. So the density of people in Sweden is relatively small as compared to other places in Northern Europe. So it may be easier for them to social distance because there are fewer people, and also they're very compliant population. So it's this is a society where you can have a shop which it doesn't have any staff in it, where people go take their items, scan themselves out themselves, pay for it themselves, and never see anybody else. So I don't think every society is equal in terms of the compliance of the population and the ability of the government to trust that the population will do the things it needs to do to protect each other. Obviously, in South Africa, we have such major inequalities that that type of trust in our society does not exist. So I think it would be difficult to expect our population to self-regulate. We can't even sort of form a proper queue in a Kentucky Fried Chicken. So I think those are the type of issues and differences between Sweden and ourselves. Whether the Swedish attempt at doing this without lockdown is successful is still not clear. It's not like they're not having cases. They've got a significant number of cases, much more than South Africa, and they've got a significant number of deaths as well. So time will tell whether the Swedish approach is successful or not.
So watch the space. Dr. Shoaib, we have to wrap up. In your last words and concluding with regard to the masks and people that are at home, they want to do something. They are in lockdown. They literally feel that, the virus is out there, but they want to be part of solving this problem. So yes, they're at home. They are flattening the curve, but what can they do at home actively when it does come to supporting and also stopping the spread?
So I think, as you mentioned, that's one of the biggest challenges with this lockdown. Besides the economic effects, is the effect of people feeling they're at home, wasting their lives, wasting their time, and being useless. But we know that, as you mentioned, there are things you can do. You can support those community projects. There are community projects which are making those visors that you saw, which are quite simple to make. There are community projects which are making masks. There are community projects which are supporting those who are in need of basic amenities. So, as I mentioned, and as you mentioned earlier, not everybody can afford to just sit at home and not work and expect there to be food in the cupboards. There are many people who live in informal settlements and other places who don't have fridges in their homes. They don't have ways to store food. They don't have the capacity to social distance within their homes or within their communities. They may need assistance in terms of basic food stuff, in terms of helping them to mitigate the risk to themselves and their family, in terms of masks and so forth when they go out. And also in terms of sanitizers and soap. The government needs to play its part. Every member of our society needs to play its part. One of the things that we've really learned as a society, as a world from COVID-19 is how interconnected we all are. The behavior and actions of the richest people in our community will affect the lives of the poorest. Absolutely. And vice versa. We always knew that rich people can affect the lives of poor people. We thought that rich people believe themselves to be immune from the behaviors of poor people. But you can see that if we have people in poorer settlements, poorer communities who are unable to comply, unable to social distance, and the virus remains widespread in the community, it will affect everybody over time. So it's all our responsibilities to make sure that we look after each other, that we use the resources we have responsibly, and then at the end of the day, what really happens in this community and with this virus is going to be in the hands of Allah subhanahu wa ta'ala. We pray that inshallah He gives us some respite, He removes this difficult test He's put upon us, and that or He allows us to pass it with flying colors, allows us to do the right things at the right time, and obviously check our intention at every moment to make sure that we're doing things which would make Him pleased with us.
Absolutely. Shukran so much for your time, Dr. Shuaib Wadi, and representative for the Islamic Medical Association of South Africa. We appreciate your time. Go well, sir, until we speak again. Assalamu alaikum. So there you have it. Unfortunately, our time has run up, and you'll see Health Matters COVID-19 Extra back again tomorrow, same time, same place, between 4 and 5. But do catch the Health Matters show this evening with Dr. Shaida Umar as we highlight how are you doing in lockdown? What is going on at home? Are the children literally driving you crazy? Or what are your challenges? We know the GBV is a big issue, people being under one roof, and emotions are running well. But Dr. Shaida from the Teddy Bear Clinic will tell us more about that in this evening show. From myself, wassalamu alaikum and goodbye for now.